Do you believe depression is a real thing?
I believe that feeling depressed is real. I don't believe depression as a clinical disease is real, no.
Really?
Correct.
Andrew Tate has become one of the most polarizing figures, really the world today. And in a interview he did with Piers Morgan, they touch on the topic of depression, his thoughts on depression, and have a pretty heated debate about it. So as a doctor, I'm not a psychiatrist, but I am a physician. I wanted to review this because this is an interview that's being seen by millions of people, and his words definitely are ones that influence today's young male generation. And that's not to say he says all good things or all bad things, but I definitely want to break down this segment of the interview and give my take on it. So let's get into it.
What do you believe about depression? Do you believe depression is a real thing?
I believe that feeling depressed is real. I don't believe depression as a clinical disease is real, no.
Really?
Correct.
You don't believe people can be clinically depressed?
I think PTSD is very real. Unfortunately, I have some friends who suffer from that. I know that feeling depressed is real. I believe that the number one power you have against these things are trying to take control of your own mind and affecting your own life. I believe that it's not healthy to hand over all your power and believe that depression is an outside disease that you can't affect. I know that when I've had difficult periods in my life, and also many of my friends, like I've said, suffered from PTSD and been through terrible things. I've lived a very difficult life, and I know people who have. That the things that made them feel better is when they woke up and said, you know what, I'm not going to allow this to damage me anymore. I'm going to take responsibility. I'm going to get up and I'm going to fight this as hard as I can.
Right, and by the way, on that, I agree.
So we agree.
Right? My favorite.
So essentially what Andrew's saying here is that he doesn't like the notion that an external disease can just be labeled upon you and therefore it takes away all of your power. Now, just because someone has a diagnosis of depression, which is a clinical diagnosis, so in medical school, we were taught a mnemonic, SIG-E caps, to memorize the symptoms of depression. And these include S, sleep disturbances, I, interest decreased or anhedonia, G, guilt and or feelings of worthlessness, E, energy decreased, C, concentration problems, A, appetite changes, P, psychomotor symptoms, or S, suicidal ideation. And to be clinically diagnosed with major depressive disorder, you need to have at least 5 of these symptoms, and one of these symptoms has to be either suicidal ideation or depressed mood, or anhedonia, loss of interest. So while Tate says he believes in feelings of depression, he doesn't believe in it as a disease state. Now, I think, and we'll get into it a little bit more what his stance is, but he's trying to say he doesn't believe in allowing external factors dictate your state of being and give up all your power. However, to have a clinical diagnosis of depression or major depressive disorder does not necessarily mean that there's nothing that can be done about it. And there's many treatments that are good options that can help people that have major depressive disorder. All right, let's see what they have to say further on this topic.
Favorite speech is the Rocky Balboa one.
Okay, so then we agree. No, we do.
Here's where we don't agree.
Piers.
You don't. Now, hang on. You got to let me interject when I don't agree with you, right? Where I don't agree with you is that there's no such thing as clinical depression. There absolutely is.
Well,
it's a proven scientific medical reality. There's a different argument about have we gone a bit too soft, right, in schools and all the rest of it. Absolutely. Do I think some people moan and whine too much about their lot in life? Definitely.
Okay.
Are we a victimhood society? 100%.
Okay.
Is there such a thing as clinical depression? Absolutely.
So
and my argument is that if you actually bracket everybody who's not clinically depressed and doesn't have the genuine medical condition, then actually if millions of people are deemed to have depression, the ones who really need the help don't get it. Well, that's my point.
Well, that I would agree with. You're right. I think it's certainly an overused term.
But you don't accept there is such a thing as clinical depression.
No, I don't.
And that to me is a damaging view.
Okay. Well, let me explain why. If someone comes to me and says I'm clinically depressed or I feel very, very sad, I would say the first thing you need to do is stop accepting the identity of a clinically depressed person. Stop accepting you have no control over this. And what you need to do is stop identifying that way, and let's work together to try and fight against it.
There isn't an eminent doctor in the world who would tell you there is no such thing as clinical depression. Who would not tell you that some people it's simply beyond their control.
I think Johann Hari wrote a book.
So I don't necessarily disagree with everything Tate is saying, besides the fact that he's saying that he wouldn't say depression is a real thing or a clinical diagnosis, because he talks about not letting it have power over you. And there's actually really good evidence showing the effectiveness of cognitive behavioral therapy, which in part is all about reframing how you perceive things. So I pulled up this article as well. This is from the American Psychological Association's website talking about cognitive behavioral therapy. And so what it says is cognitive behavioral therapy is a form of psychological treatment that has been demonstrated to be effective of a range of problems, including depression, anxiety, alcohol and drug use problems, marital problems, eating disorders, and severe mental illness. There's been numerous research studies suggesting that CBT leads to significant improvement in function and quality of life. All right, so let's see what are the tenets of CBT. So these include the fact that psychological problems are based in part on faculty or unhelpful ways of thinking. Psychological problems are based in part on learned patterns of unhelpful behavior, and people suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms and becoming more effective in their lives. And then the treatments usually involve efforts to change your thinking patterns. So strategies would include learning to recognize one's distortions in thinking that are creating problems and then to reevaluate them in light of reality, gaining a better understanding of the behavioral and motivation of others, using problem-solving skills to cope with difficult situations, and learning to develop a greater sense of confidence in one's own ability. So I'm a big proponent of CBT, and I don't think that the claim that major depressive disorder or depression is a clinical diagnosis that someone could have means that that person has to give up all their power to the disease, which is the claim that Tate's making it, which is why he likes to assert that he doesn't believe in it as a clinical state. So I get the point he's trying to make, and I don't think he's so far off. I think it just is a little bit extreme to say that depression doesn't exist, just feelings of depression. Because if you at least go by the DSM-5, we know that if you have the symptoms that we described, 5 symptoms, one of them either being depressive mood or anhedonia for more than 2 weeks, that's going to classify you as having major depressive disorder.
Johan Hari wrote a book saying exactly that, my friend.
He's not an eminent doctor.
No, but
he's a journalist.
I said depression wasn't real long ago and was attacked for it. Then Johan Hari wrote a book, which
What's
actually...
What's it got to do with Johan Hari?
Because he wrote a book proving me right. Most people...
Johan Hari's a journalist.
Sure. And my point is that a lot of people who are clinically depressed are suffering with something in their life, and if you fix the problem in their life, perhaps they won't feel depressed anymore. That's not a disease.
Yeah, but Andrew...
That's situational.
Andrew, you're simply wrong.
If that's what you believe, Piers,
it's what I believe.
I don't believe in things that take power away.
There is not an eminent doctor in the world
Piers,
that would agree with you.
Piers,
do you think you know more than doctors?
I can't become clinically depressed.
Why do you know?
Because I don't believe in it. I can't be haunted by a ghost if I don't believe in ghosts.
Well, that's like saying I'm never going to die because I don't believe in it. It's ridiculous.
Perhaps, but if it allows me to live a life where I feel happy and content within myself.
This is that little area where you lose me.
No, I don't lose you.
You won't, because
Piers,
somebody with your following says
the thousands of people who have emailed me saying my doctor told me I was clinically depressed and it's a disease that I have got in my brain and I can't be fixed. And I started listening to you and I realized that...
Okay, I don't believe that any good doctor would say that they have clinical depression and it's a disease that cannot be fixed, because there's lots of treatments. We'll get to that in a little bit, but CBT, like we just mentioned, even exercise, certain pharmacological medications, if necessary, that can help with depression. So that's not how a good physician would frame the issue. They might give a diagnosis of depression, but it doesn't necessarily mean they would frame it in a way that it's something that you're going to be stuck with forever, or that you can't improve. And it's like this terminal, helpless diagnosis.
And I realized that that's not the case and I can fix my own life, and you're the only person who has ever helped me.
Oh, Andrew.
Thousands of people have emailed me that exact email.
If you think you are single-handedly curing people of clinical depression, you are living in cloud cuckoo land.
I am reading the emails of people who I have cured of clinical depression.
You're reading emails from people...
Okay, well then, if he's saying he's cured him of clinical depression, then he's also saying that he believes that clinical depression is a real disease. So that kind of counters the logic he used earlier. With that said, I don't necessarily think it's impossible that from certain advice that Tate gives, he has helped people who were either feeling depressed or technically had a diagnosis of depression. And I know some of the things that he likes to recommend is exercise and also just reframing your own thoughts about the disease, which again is not actual CBT, but it's like starting to go along the lines of what someone who's trained in CBT would do with a patient.
People who have believed you when you say there isn't such a thing, and they've probably never been diagnosed clinically depressed. They just want to go along with what Andrew Tate says.
I don't think so.
I think your view of that view is dangerous.
I respect that you think my view is dangerous, and I respect you have the right to view that, to think that. I think that clinical depression, I actually agree with you, is massively overdiagnosed. I've already said that PTSD is a very real thing. I've already said... hang on. Okay.
Again, you're misquoting me. I did not say clinical depression is massively overdiagnosed. I said that people who claim to be depressed but don't have clinical depression, I think that is massively overblown, right? In other words, there are a lot of people who just have a bad day and declare, I've got depression.
Yeah.
And I say, well, have you been to a doctor? Have you been clinically diagnosed? If you have and you have clinical depression, that's one thing. But if you haven't, we could probably work on some mental strength and resilience skills with you. But a clinically depressed person has an absolutely proven medical condition that is beyond their control.
Not according to me and many others, my friend.
Well, look, what do you know about it, honestly?
So I agree with Piers there, where he's saying that there's definitely many people that have clinical depression. I think he's using the words beyond their control, like in the sense that they didn't choose to be depressed or have this diagnosis. But even if you have the diagnosis, it doesn't mean you don't have control in how you can approach it and get better and improve over time. Now, it can be very difficult. Some symptoms of depression, and if you have MDD, can be extremely debilitating and should be taken seriously. But it doesn't mean you have to give up complete control to the disease.
I know.
You're not a doctor, or you're not trained, are you?
I'm not a doctor.
You're not a psychiatrist. You're none of those things.
Sure.
You're a guy on the make. He's done very well for himself, spouting stuff off, much of which I agree with, as you've seen in the interview, but some of which is ludicrous, and that's one of them.
It's not ludicrous.
It is.
It's not.
If you said to me, we're in a victimhood society, it's got to stop, I'm with you.
Okay.
But the moment you try and deny clinical depression...
I believe feeling depressed is real. I do not believe it's a disease that you catch from the sky and you cannot affect. I believe that no matter what happens, I believe you have control of your own mind and you can fight against it. I believe if you change your circumstances in your life, you may feel different. I'll give you a quick example. I had a guy who emailed me saying he was clinically depressed and he was going to kill himself. I obviously am not a psychiatrist, I'm not a doctor. I told him, because I replied to my emails. I said, have you been to a psychiatrist? He said, yes, I'm clinically depressed. I've been on these pills, this amount of time. I'm on antidepressants, it doesn't work. I said, I don't know what to say to you besides this. And he said he lost his girlfriend, that's why he became clinically depressed. I said, listen, go to the gym, get a six-pack first. Once you've got a six-pack, email me again. If you still feel like killing yourself, I don't know what else to say to you. But I'd say, strong body is a strong mind, go train. He went, he started sending me progress pictures, emailing me him getting in better shape, and eventually got a six-pack. He's now a professional bodybuilder. And he said, I can't believe I was considering that. I feel so much better, etc. The doctor was telling him he was clinically depressed and couldn't cure it. He started taking control of his own life, and now he felt better. Now, I'm not saying it's...
Again, I hope not, that a doctor would not be saying, you're clinically depressed, you're stuck this way, you can't cure it. Additionally, there's a lot of different pharmacological medicines that can be used for depression, even within the same category. So certain SSRIs or SNRIs, not all of them will work the same for all people. Additionally, it actually can take a few weeks to see the improvements of these medicines. So sometimes that could be up to 6 weeks, and I'm not sure how long this person was on those medicines for. However, there's also many people that the medicines won't work for, which is why it's good that there's other potential options. One being cognitive behavioral therapy that we discussed. The other one being exercise, which is very interesting because that's what he recommended to this person. So again, I'm not saying that everything that Tate's saying here is actually bad, because some of the advice is useful. I just think the framing he's trying to use is like depression doesn't exist at all as a disease. It's an unnecessary claim. I get the point he's trying to make. You don't have to make that claim. All you can just say it's a disease, but it doesn't mean it's a disease you have to give up all your control to, right? Because there's other things, I bet he would, I don't know, but other diseases, like you can have high blood pressure, doesn't mean you're stuck with high blood pressure. You can have diabetes, and actually through proper exercise and habits, it is possible to reverse diabetes if it's type 2, not type 1. So it does make sense that if he's told this person to exercise, they started exercising and they were determined and they had a goal and they were working towards it and they got a six-pack, that in itself can start to really relieve the symptoms of depression. And ultimately, once you don't meet those criteria anymore, you would technically be no longer carrying a diagnosis of major depressive disorder if it's for an extended period of time. So I wanted to pull up this article, which was in the Journal of Affective Disorders. It was by Kavam et al., and it was titled Exercise as a Treatment for Depression, a Meta-Analysis. So what a meta-analysis is it basically pulls together lots of independent research studies that are looking at very similar outcomes and comparing similar control and treatment groups, and pulls all of that data together to make one overarching conclusion, because you really don't want to just take one study as giving a definitive answer. It's just one component to when researching a question or topic, because each study is going to be designed differently. The methodology might be faulty. So you have to be very careful when you take just one study alone to be able to make a conclusion. So this meta-analysis, which was of randomized control trials, which are important because those are going to be higher quality studies, examined the efficacy of physical exercise as treatment for unipolar depression, both as an independent intervention and as an adjunct intervention to antidepressant medications. So this study took a total of 23 randomized controlled trials. Ultimately, that was 977 participants, and showed that physical exercise had a moderate to large significant effect on depression compared to control conditions. But the effect was small and not significant at follow-up. Exercise compared to no intervention yielded a large and significant effect size. So that makes sense. In comparison to doing nothing, there was a major effect seen when comparing to someone that was exercising. And then if we go down to the discussion section, we see that it says when exercise was compared to established psychological treatments such as CBT or antidepressant medication, the effect size were small or close to zero, which means there's basically no significant difference between the two groups, which is actually a good thing, because if exercise didn't work as well in comparison to those interventions, then you would have seen an effect size favoring either antidepressant medications or CBT. And if you scroll down, it says, on the basis of findings in the current meta-analysis, exercise as a treatment for depression can be recommended as a standalone treatment and as an adjunct to antidepressant medication. So for someone that antidepressant medication is working for, exercise should enhance the overall effect. And for someone who doesn't want to take antidepressant medication, or the antidepressant medications that they're on were not working for them, exercise could be a good alternative. And just jumping quickly to the study characteristics, you could see the type of exercise that we're talking about here is walking, jogging, running, cycling, home-based walking. So it's not even intense weightlifting or things like that, which are good, but we're just talking about simple aerobic exercise such as going out for a walk for 30 minutes every single day, which is great for many other things besides the depression. But if you're someone that's watching this that's depressed and you haven't been doing anything, try just starting every day to go for a walk. Maybe it's 10 minutes the first day, then 20 minutes, then work up to 30 minutes, and see how that may help.
I'm not saying it's the case for everybody.
No.
I'm just saying.
Here's my question, though. Have you seen the guy's medical records?
Of course not. I just told you the
So
story.
you're just taking his word for it?
I am taking the words of a man who emailed me with a bunch of medication in specific
So you're
doses.
denying proven science because one guy writes to you who you help and you've not seen any evidence he ever had clinical depression diagnosed.
I'm denying the idea that...
And on the back of it, you go on your rants in public to tens of millions of people denying something because this guy writes to you and says he had it and you cured him. And I think that's a dangerous mindset, Andrew.
That's fine.
And that's where you don't have a responsible view of your influence over
Disagree.
people.
It's very responsible because I'm saving people's lives. I disagree that if you feel depressed, I disagree that you cannot affect it and change your life and take control and fix yourself and feel happier. I disagree with that.
Do you think
I agree with that too, and I don't think that either Piers or Andrew or many doctors or psychiatrists would say that you can't take control. They would say that depression is a real disease and it affects a lot of people and it can be very debilitating. And so it's not something to just say, to dismiss and look down upon if people have a diagnosis of major depressive disorder, because it's a very real thing. Will there be people that might self-diagnose that don't actually have it? It's possible, but it's definitely something that affects a lot of people, and there are many ways to ultimately help someone's overall life from improving if they have depression. And I think that's where the crux of the misunderstanding in this argument is. Just because I feel like the point that Tate is trying to make is that if we say that this is a real disease, that means we're taking all the control away from the person in fixing it. I understand what he's trying to say there, because I do agree that it's important to not feel like this is a helpless cause that can't be fixed, because you can completely improve your life. You can get out of having major depressive disorder, but it's something that can be very challenging for people, can be very debilitating, can last for a very long time, and can require a lot of work with a psychiatrist, a licensed therapist, and with yourself.
I refuse to accept that there are people out there who cannot become happy, contented individuals. I refuse to accept we live in a world where God has created people who, no matter how hard they work and how good their life becomes, can't be happy. I don't accept that. I accept that the universe is a very giving place and that God loves all of us. And if you try your best and you work hard, you can become a better person. And I also will argue with you, and I'll counter the point, that you sitting here on your platform telling people they have clinical depression, there's nothing they can do about it, is far more dangerous. Okay, well then, if they have clinical depression...
Why do you misquote me?
No, because you're saying...
You hate being misquoted.
No, you're saying if people have clinical depression, then they have a
nothing
disease.
to do about it. They go to a doctor and they get diagnosed and they get help.
Then I would argue the point that if
It's the
somebody...
complete opposite of what you just said I said.
I would argue the point that if somebody has depression of any kind, whether it's clinical, whether it exists or not, whether they feel depressed or not, whatever, that taking control of their life, taking personal responsibility and working hard is always going to be the positive, best thing they can possibly do for their life going forward.
How positive
and the people
is
going around
it?
them. So sitting here saying, I don't believe in clinical depression, you don't believe in depression. No, I don't. I believe that people can take control and fight against things.
Right.
I believe in personal sovereignty.
Right. Fine.
Okay, so in conclusion, I think that Tate and Piers Morgan are actually agreeing more on this topic than they think they are, and they're just debating for the sake of debating, because I watched the whole interview and they're debating the entire time on a lot of issues, some very, very controversial, and they both have overall good points. And I think that some of the things that Tate says is uplifting. It can help people. Exercising is important. Trying to reframe how you think about things and being willing to work hard and try to improve your overall situation is important. Sometimes depression can be so bad, though, that you feel like you cannot even get started. And so there are times when medical treatment is definitely necessary, and definitely working with a psychiatrist and a licensed therapist is very important. And I think that two things can be true at once. You can have a legitimate diagnosis of major depressive disorder and also not have to give up complete control to the disease and work to improve your overall health, your both mental and physical health, how you're feeling, and are able to get out of it. So I'll leave you with that. What do you think of this heated debate? And if you are someone watching this that struggles with depression, I will leave some links in the description for where you can go to get help. Wishing you all the best. And if you're getting any value from these videos, would love it if you could like and subscribe. Thanks so much.